Today, I'm going to teach you 3 easy steps for implementing WH questions therapy with your students. But first, I want to ask you a personal question. Do you feel like the woman on the slide? Do you have so much to do that you feel like you are going to go crazy? If you answered yes, you are not alone. Many SLPs feel like this, including myself. I want to make your job a bit simpler so you don't feel like the woman in this video. So before we get to the easy 3-step process, I want to talk about why it's important you learn the information presented in this video. Have you ever heard of a term called multiplying your time? This is a concept that I originally heard about from Corey Vaden, who hosts a podcast that I listen to. Time multipliers ask, what can I do today that will make the future better? You don't become more efficient by doing all of your tasks faster, but rather you become more efficient by spending time today on learning systems that you can implement that will save you time in the future. So, spending 30 minutes on this mini course to learn a system that really works with any skill-based intervention will save you time in the future. So for the next 30 minutes, give yourself permission to spend time learning a 3-step process that will give you time down the road. Let's get started. First, I'm going to show you how you can implement WH question therapy with just 3 easy steps. Remember, we are creating a system that saves you time in the future. Then, I'm going to talk about the resources I use in the presentation and where you can find them. So just a quick snapshot of myself. My name is Catherine, and I am the itinerant clinician. I'm a school-based speech therapist just like you. I work primarily with pre-K through elementary age students. I've been dedicated to my career for almost 20 years. And then in addition to my full-time job, I guide other SLPs on the difficult journey of being a school-based speech therapist. So just a couple of learning environment expectations. First of all, this is a judgment-free zone. If you are viewing this as part of an email, don't hesitate to hit reply if you have a question. If you are watching this on YouTube, leave a question in the comments. I will attempt to answer questions within 24 hours. And then the second expectation I have is I am not a perfectionist and I don't expect you to be either. For our time together, I want you to take the pressure off of yourself to feel perfect. Remember, you are not chasing perfection, just progress. So for the next few slides, I'm going to get rid of my picture because there will be pictures on the screen. You will see me again at the end of this presentation. So just an overview of the 3-step process. The first step is collecting pre-intervention data. The second step is using that data collected in step 1 to write your students' goals. And step 3 is implementing therapy. So before we start, I want you to think about a student on your caseload who is currently working on or could work on WH questions. So the student I'm thinking of is Jack. He is a 4-year-old student in a 4K program. He enjoys teacher-directed tasks and is able to participate in easy turn-taking games. Jack has difficulty answering WH questions. This impacts his ability to participate in conversations and convey academic knowledge. So let's talk about step 1, which is pre-intervention data collection. Determining IEP goals and planning speech therapy intervention depends on knowing how the student is currently performing with a specific skill. Now, when I give examples for the rest of this presentation, I am going to focus on what questions. But please know that this applies to any WH questions or any skill-based therapy intervention. So we start by using a baseline assessment. For assessing what questions, there are 2 assessments that can be used. One is for pre-K students and one is for elementary age students. The reason there are 2 different assessments is because there are 2 different sets of expectations based on age. So here is an example of Jack's baseline assessment. So again, Jack is a 4K student, so he used the pre-K version of the baseline assessment. Now I do want to explain a couple of things about this baseline. So you can see there are gray columns and there are white columns. The gray columns are for your pre-intervention data. The white columns are for your post-intervention data. Now, you can see there are 2 columns within each section. We have a column A and a column B. So I'm going to explain those next. So column A is assessing if the student is responding to the word what correctly. So in this first example question, what do you throw? That answer is going to be an object. So Jack got a plus because he responded with an object. Now column B assesses if the answer is accurate. So again, if we look at number 1, Jack's response was a ball. That is an accurate response to the question, what do you throw? But let's go to number 2. What do you eat? So Jack responded, pencil. So in column A, he got a plus because that is an object. But in column B, he got a minus because that's not an accurate answer. So on this assessment, there are 3 questions that require an object answer and 3 questions that require an action answer. Now, I want to talk a little bit about the totals. So you can notice that the total in column A and column B for Jack were pretty similar. So what that tells me is that he needs to work on understanding that what part of the question. But let's pretend that column A is 100% and column B is 33%. So what that tells me is that, yes, that child is responding to the word what correctly with either an object or an action, but the answer is not typically accurate. So in that case, it's probably more of a vocabulary issue than it is understanding the word what. But again, for Jack, we see that those numbers are pretty close together. And so indeed, he does need to work on what questions. So we are ready for step 2. We are going to write the student's goals. So these are just some examples of goals that can be written for a student. For Jack's goals, I decided to make his goals very specific because his parents were very involved in the IEP process and wanted to know developmental steps. So there are numerous ways to write goals and objectives. Just use your clinical judgment when creating the goals. So when we look at these goals for Jack, goals 1 and 2 go together and goals 3 and 4 go together. So goal 1, Jack will answer what questions in which the answer is an object with picture choices. And then goal 2 is the same goal, but without picture choices. And then goal 3 is Jack will answer what questions in which the answer is an action with picture choices. And goal 4 is the same goal, but without picture choices. So we are ready for step 3, which is to implement therapy. Now in this section, I'm going to explain 5 different things: explicit instruction, implicit instruction, focused implicit instruction, a hierarchy of intervention for what questions, and then a therapy plan. So let's talk about what instructional strategies to use with your students. So let's start with explicit instruction. Explicit instruction means teaching the skill directly. So if we are talking about what questions, you are going to teach the student that when they hear the word what, their answer is going to be an object or an action. Now, the picture I have to go along with explicit instruction is a picture of what traditionally happens in classrooms. So you have the teacher teaching a skill directly and the student learning that skill. Now, implicit instruction is very much the opposite of explicit instruction. Implicit instruction involves exposing the child to different skills and hoping that he or she learns those skills without the need for explicit instruction. So for this picture, I chose a daycare classroom because what happens in a daycare classroom is a lot of implicit instruction. The teacher exposes the child to a variety of different developmental skills, and the hope is that that child will learn those skills. Now, if we think about this in the context of typical language development, children learn language through implicit instruction. Now, I'm going to talk about focused implicit instruction. So this is kind of a happy medium between those two types of instruction. So for my students who cannot learn by explicit instruction, usually because they are just too young, I use focused implicit instruction. Now this is a term that I coined. So focused implicit instruction involves focusing the child's attention on several trials of a target skill with minimal environmental distractions. So one way to use this type of instruction is through the use of flashcards. So what does research say about instruction? So in the area of grammar intervention, there is research that suggests combining explicit instruction with implicit instruction is more effective than just implicit instruction alone. So what did I choose for Jack? So remember, Jack is in 4K. He's really, really young. So in his case, he was too young for explicit instruction, but needed more than just implicit instruction. So I used focused implicit instruction with him. But let's pretend Jack had been a little bit older. Then I would have used a combination of explicit instruction by using these materials below to specifically teach the skill with focused implicit instruction, which is more of the practice component. So next I'm going to talk about a what question hierarchy. So here is a hierarchy of complexity when it comes to teaching what questions. So for pre-K students, there are 6 sets of flashcards that I use. And for older kids, there are 2 additional sets. So where did Jack start? So again, he is a pre-K student. So I used the pre-K scope and sequence checklist. Now, Jack was really, really good at answering basic questions. So set one would be answering the question, what is this? And then him labeling an object. He was really good at that. He was also good at answering questions that just required him to identify an action. So what is the person in the picture doing? However, when we got to more of the intermediate questions, that's where there was a breakdown. So I decided to start at set 3. Now let's talk about an easy therapy plan. Now, if you remember, one of Jack's strengths was participating in easy turn-taking games or activities. So his therapy plan was pairing a game or activity with flashcards. So in between turns of the game or activity, I would present 1 to 2 flashcards. And it was just that simple. So let's finish our story. Jack progressed through all the sets. So that was set 3, 4, 5, and 6. And then I re-administered the baseline assessment. And he got 100% accuracy for responding to the word what, and also 100% accuracy for giving accurate responses. And then anecdotally, his teacher reported that his conversational skills were progressing because now he was understanding that word what. So I do get a few questions when using these flashcards. So the first question is, when do I know how to move to the next set of flashcards on that hierarchy? So when the student is 80% accurate for 2 or 3 consecutive sessions, then I move to the next set of cards. And when that student has progressed through all of the sets that I want him or her to do, I update the baseline assessment. Do you use the same set of flashcards for each session? The answer is yes. Now, you would think kids would get bored with these flashcards, but that has never happened. As long as there is an interesting game or activity paired with those flashcards, they are all for it. And that allows me to use these flashcards all year long. So when I presented that therapy plan of a game or activity paired with flashcards, that's what I do all year. And it saves me tons of time planning. And do students make progress? The answer is yes. Every student that I've used these questions with has made progress. And here is a surprise. This type of therapy generalizes to conversational skills. So when I started using this hierarchy, I expected students to meet their goals, just to answer questions. What I didn't expect is that it would help their conversational skills. And those questions that we worked on in therapy would just naturally generalize to conversation, which was really, really cool to see. So again, working on these questions with that focused implicit instruction really supports that student participating in conversations in the classroom environment. So now we are on to the second part of this mini course. I'm going to tell you where you can get the materials that were featured in the course. So I do sell this as part of a package on Teachers Pay Teachers. You can see the picture here is the listing. On the left-hand side of the screen, there is a QR code that will take you directly to the product. So when we talk about the What Questions flashcards, there are 8 sets of flashcards, which equal 281 flashcards. So what is included in this package? So you get the 8 sets of flashcards. The flashcards are separated into basic, intermediate, and advanced questions. So at the basic level of what questions, there are 2 sets. Now these questions are perfect for very young students or students with severe language impairments. So set 1 focuses on identifying an object or an animal, and there are 27 of those. Set 2 focuses on answering what questions with an action, and there are 35 of those flashcards. And Meg used these. She said they're great for my ASD students, super helpful, and can be used for a variety of activities. Thank you, Meg. Now, the intermediate level of what flashcards will probably apply to 80% of the kids who are working with these flashcards. So set 3 and 4 go together. So set 3 requires the student to identify the function of an object with picture choices. And then set 4 is the same skill but without picture choices. For set 3, there are 27 flashcards, and for set 4, there are 40 flashcards. Now set 5 and set 6 go together. So for set 5, these require the student to answer a what question with an object. So set 5 uses picture cues. Set 6 is the same skill, but without picture cues. Set 5 has 43 flashcards, and set 6 has 40 flashcards. And then finally, there is an advanced level for what questions. Now, this is an optional level. If I use this level, it is usually with older students. So set 7 and 8 also teach the same skill. So set 7 has the student answer what questions with a description with picture choices. So the example here is, what is a pig like? And there are 29 of those flashcards. And then set 8 works on the same skill, but without picture cues. And there are 40 of those flashcards. This package also comes with the 2 baseline assessments that you saw in the presentation. There is one for pre-K students and then one for school-age students. And Jennifer said, this is going to be a quick progress monitoring tool for my lower level students this year. Thanks so much. You also get the goal suggestions that you saw in the presentation and the explicit instruction teaching materials that I talked about. And finally, you do get the what question teaching hierarchies, and there are 2, one for pre-K students and one for school-age students. And Ashley R. said, just what I need to work with my preschoolers who are learning to answer questions. Love that it has steps and resources you need for each WH question. Highly recommend. Now, I'm going to ask you another question. Do you want to increase the value of your dollar? Of course you do. Who doesn't? So chances are, if you are working on what questions with your students, then they will also need to work on other types of WH questions. Or you could have other students that have mastered what questions but need to work on questions like who and where. So in that case, I recommend the WH question bundle. Now on the left, there is the QR code again. This code is different from the one you saw before. This will take you directly to the bundle. So what flashcards are included in this bundle? We have who questions, what questions, when questions, and why questions. And if you purchase this bundle, I will also throw in where questions for free. Now the where questions are only available as part of this bundle. The other types of questions can be purchased separately. So if you think about all those flashcards, that gives you a total of 1,059 flashcards, which is more than enough to keep you going all year round. So I just wanted to go through each type of question and exactly what you are going to get. So the WHO questions are split into 3 groups: basic, intermediate, and advanced. Something nice about the WHO question flashcards, many times we have resources to work on those advanced questions in which we're looking at answering WHO questions with an occupation, but we don't have the ones in the intermediate category, which are more of the personal who questions. So these would be questions like, who is your teacher? Who are your parents? Who do you live with? Who are your friends? And then I do have one questions as part of this bundle. And that is split into 2 groups, which is basic, intermediate, and then advanced. Why questions, which is split into 3 levels: basic, intermediate, and advanced. And then the bonus material, again, are the where questions. And these are also split into 3 levels: basic, intermediate, and advanced. And remember, these where questions are only part of the bundle. So in addition to those 1,000 plus flashcards, you are also going to get baseline assessments for each type of question. So for what, who, and where, there are actually 2 baseline assessments, one for pre-K and one for school age. Oh, excuse me, there is only one for where questions, and then one for when and why questions as well. Also included in the bundle are the explicit teaching materials for each type of question. And then finally, we have the teaching hierarchies for each type of question. Now, this is a lot of flashcards, so I end my presentation by telling you how I organize them. So I actually have one of those photo box kits, and these flashcards are the perfect size to fit in those card holders. And you can also see within the card holders, each set is also put together with a binder clip. So when I have therapy, I just go to my box here, I pull out the level I need and use it with my students. It's a very simple way to organize my materials. If you've made it to the end of this presentation, congratulations. Thank you for taking the time to learn my 3-step process that will multiply your time. If you have any questions about this presentation, again, if you were receiving this as an email, reply to the email. If you are viewing this on YouTube, please leave a question in the comments. Thank you.